open my slides here for you. So welcome, it's COVID-19 Tough Decisions for Business Owners, and today is episode 16, How to Reopen Your Business Safely. My name's Hilda Gan, and I am the owner and founder of People Bright Consulting. So we started COVID-19 Tough Decisions for Business Owners as a webinar series to answer the needs of managers and business owners and HR decision makers. It's hard to believe, but it's been 9 weeks now when we found out in the province of Ontario that we were in emergency, a state of emergency, and that meant that social distancing and only essential businesses were opened. And as HR experts, we realized there was a lot of changes happening very quickly that impacted on businesses and impacted on the employees and owners of those businesses. So that's why we started this series, and we've been providing tips and strategies to help you through these very tough decisions by giving you information, helping you think about what you need to do. If you like us, we are on social media, of course, and you can tag us at PeopleBright or at hashtag COVID-19 TDBO. So just a little bit about myself. I am the founder and president of People Bright Consulting. I created a concept called Connect with Rev Up, which really helps build strong workplaces. I am in a work culture specialist. My husband and I started an engineering company in the late 90s, and it was a company that we're very proud of. We grew it from 2 people to 125 people, and we had 7 offices across Canada. We became recognized as a best workplaces in Canada, top 10 twice. And the reason for that was really we wanted to create a special place where people felt professionally that they were growing and they were challenged in a way that they enjoyed. As well, we wanted to create a place where people felt valued and connected to each other. So we strived very hard to create that place where people felt they belonged and were respected and valued. I have a very wide background. I started my career in nursing. So through the years, I have been gaining experience in healthcare, human resources, engineering, professional services firms. I even had 4 years where I was involved in the IT world, and I deal with not-for-profits. So our focus today will be about how to reopen your business safely. And what I want to share with you is the risk to your company if you don't open safely, because this is the key thing, is that you really need to understand what the risks are to you and to your company. To determine the necessary precautions needed, to give you some tips and strategies to consider what you need to do to open safely. And I knew at the beginning when we were just having an open discussion, said there's so much information and it's hard to figure out how to interpret it. And it will be interesting how people do interpret what needs to happen. The fourth thing I want to share with you is what you need to do to provide for the safety of your clients and your staff as you reopen your business. So I'm going to be giving you a lot of food for thought today. The last thing, because I am an HR specialist, is really to kind of help you understand some of what the HR and the HR legal concerns that may arise regarding staff returning to work and how you might address these concerns. So these slides I'm just going to go over quickly. At the end of the session, we always send you a copy of the slides and a copy of the link to the webinar series. So I want this to be a handy reference for you, but each province has a recovery plan and each province will share what they are. So here is the links to that for you. So this is for the east side and this is for the west side. Just a few highlights, and these are always evolving, but in the province of Quebec, for example, they started on May 4th by opening non-essential stores outside the Montreal area. So the rest of Quebec essentially opened. And on May 11th, manufacturing and construction reopened as scheduled. They started to open the elementary schools this week, in the provinces except in the Montreal area. What they decided in Montreal was there was too many COVID people having COVID or in quarantine for COVID, and if the services that they provided from a healthcare perspective were not enough, that would hold them back, and that's what's happening in the Montreal area. But they have now said that on May 25th that the non-essential stores within the Montreal region would be opening. So that's been delayed by at least a couple of weeks. They've also announced that daycare will be open in the Montreal area in a week, on June 1st, and that has been delayed by a week. Elementary schools in Montreal, though, are still closed, and they announced they will not reopen until September. High schools and universities and colleges are rescheduled to open in the fall. All of this is on the proviso that all public safety measures must be adhered to. In Alberta, they've just announced that on May 13th, they will start their stage 1 opening, except in the areas of Calgary and Brooks. These are staged over 2 weeks, these openings. And I think the interesting thing about that is you're finding that a province will decide where should we open. We shouldn't delay opening the other parts of the country or the province if things are the numbers are okay. But in the areas, in this case, Calgary and Brooks, or in the case of Quebec, Montreal, these are delayed. So what's happening in our province is, I'm not going to go into the details because I think that's something that those of you who are from Ontario or whichever province you are from, you should go and dig deep and find out what's happening specifically, because you're obviously going to read that with your lens and you're going to decide, this is what I need to do. I'm a marina, so I can open on March 16th. I am a medical spa, so I have to wait to find out the places that I can actually, what time I can actually open up. So there are workplace safety guidelines now in place, so you need to, if you're in Ontario, go find those. And if you're in any other province, go find the ones for your province. On Saturday, May 16th, parks, golf courses, marinas, and others will be reopening. And on Tuesday, May 19th, the Premier announced that we are entering a new stage and that retail with street entrances will be allowed to open, as well as a whole other host. So again, don't want to spend our time sharing what is or what is not. You need to go and look. Emergency measures have been identified to continue to June the 2nd. Regardless of whatever province you are in, everyone is saying all your public safety measures must be adhered to. And Premier Ford yesterday said, open only if you're ready. So if it says you can open on May 19th, but you're not ready, wait, because it's important that when you open, you are opening safely. And I'll get into that. What does that mean? So I want to open it up now for some discussion, because I want to know, how are you feeling about reopening? What do you think others are feeling about reopening? And when I say others, what do you think your clients are thinking about reopening, and what do you think your staff are thinking about reopening? So I'd like to open it up for some discussion. If people want to put it in the chat line or they want to talk, I'd love to hear what you guys are thinking. So I want to take about 3 minutes to gather some thoughts, because this will help you focus for the rest of this presentation. So don't forget to unmute yourself.
Casey.
Hi, Casey.
Hi. So you can hear me now, good.
We do, you're loud and clear.
So I would say that there are mixed feelings about reopening. I think, even myself dealing with this in HR, I think that we have people who are thinking that this is still early and there's still a lot of unknowns, and that, even with the steps that the businesses are taking, those who are reopening, I still think that a lot of people would prefer to be a lot more cautious.
Mm-hmm. Others? Any other comments? Thank you for sharing that. Can you say what you've actually, like, what are you guys are working remotely now, and a little bit about what your business, very just like we're in this business.
So did you want me to say that? This is Casey again.
Yeah, just quickly so that other people have a chance. Are you guys working remotely?
Okay.
And the nature of your business,
So
just
we are
one
in
word.
manufacturing.
Thank you.
Yeah, so we are in manufacturing. We were considered essential. So technically we did not completely shut down, but we were mostly closed because our customers were. So we are in the process of slowly reopening now.
Okay. Any other comments? If somebody's talking, you're on mute. Okay, well, I want you to think about this. What are you thinking? Go ahead. Go ahead.
I'm having, like Casey, I'm having mixed reviews. I've got some of our employees have health concerns, like they live with someone who is elderly, or they live with people who have compromised immune systems. So we're doing our best to help them work work individually, so that they're not with other people, like put them on projects where they can work alone. And we're providing PPE, like masks and gloves and things like that for our employees who are in the field. And we have brought employees back through the queues, and we're topping up, but not to 100%. And we're getting mixed feelings on that. Like, most people are saying, yep, I'll come back, and we've got a few that are grumbling to come back under those conditions, and then we've got actually only one who refused to come back under those conditions. So,
and what did you do with the refused one? Did you terminate them, or did you find something, a different solution?
we just said, that's your choice. Not sure that you're still going to be eligible for the CERB under these conditions because you're declining our offer. But that's up to that employee.
Okay, good. Okay, thank you for that input. I want you to think about what your own feelings are about reopening, and what you think your staff's feelings and your clients, because this will help you as I continue to get you thinking about how to reopen safely. So I'm Asian, as you may have seen from the beginning of the webinar, and when we do we don't have an alphabet, but we do picture words. And the picture word for crisis is actually a combination of two separate words. The first one being danger, and the second one being opportunity. So COVID is a crisis, and with crisis comes both danger and opportunity. And what I really want to share with you today is the danger first. If you heard my presentation last week, we talked about the opportunity first and then the risk. But opening safely is a risk. And what I want to share with you is the big risk is and let's look at number 2 first on the dashboard, is safety. And that safety is what happens if I open and somebody gets COVID, worst case scenario, and ends up dying, whether it's a client or a staff, and they can directly relate it to something we as a business did or did not do. Imagine the consequence of that, the legal action that would be taken by the person, the safety aspect of somebody from the government's perspective because you didn't meet the deadline or the guidelines. What happens if it is a worker, and the WSIB implications? The bottom line is this can cost your company money, along with not just the financial side, but imagine what that will do to your business. Imagine what that will do to the work culture, the emotionality around that. So it is so paramount to get this right. So what are the risks? First of all, the government has created these guidelines. And if you don't follow them and they deem that you have not followed them, there could be penalties and fines. They could shut down your business. And imagine your reputation if they said, so-and-so shut down. There was the factories in Alberta, the meat factories, and they got shut down. So now we always associate Alberta with great beef, but now we are associating with their two top plants in Alberta had COVID run through their manufacturing plants. I think the statistic was half of the cases of COVID-19 in Alberta were from these two factories. So imagine what that's done to the reputation of those two facilities. The third thing is risk for staff. And Diane alluded to that. There's the refusal to return to work. And if staff get COVID, what happens? And you need to make sure that you, in your plan, think about if people get COVID, what do we need to do for quarantine? Then for quarantining staff, what does that do to our ability to deliver our services? You know, do I have adequate staff for that? What are some of those mental health concerns? Indicated in the Mood Association of Canada that the number 2 cause of disabilities in 2020 will be depression. Heart attacks number 1, depression number 2. So next week's session that we're giving is my friend Helen Patterson and I will actually be having a dialogue about mental health and how to promote mental wellness in the workplace and to talk about depression and how to find those signs and symptoms. The other concern will be if the staff aren't following guidelines. You know, what if somebody is being very casual about things and putting staff at risk? You will need to think about how you're going to manage that. And my suggestion is that you do talk to these people and you share the expectation that that's not acceptable. That is an unacceptable performance. The strain that this is having on working relationships as you're talking to people, Diane mentioned this one person who doesn't want to come back, and that's put a strain on that relationship, whatever that outcome will be. Then there's the idea of access to supplies and additional costs. You need to figure out what these costs are because you still need to make money at the end of the day. So don't forget to factor in any wastage of supplies. Those people are in the restaurant food industry. They need to buy enough food for the people that come, but if they buy too much, it could be causes wastage. Then there's the idea of PPEs. You need to make sure that you have enough and have supplies for that. So do your calculations and make sure that you're still balancing what you need to do by still being able to make as much money, loss, or profit as you can during these very difficult times. The last piece is communication and marketing planning. I think this is one of the pieces that people often overlook when they're implementing anything is get the stuff done, but you forget how to communicate that effectively. So if you don't communicate effectively, if you don't have a marketing plan, this could tarnish your brand. It could put a strain on your relationships with your staff, and you could end up losing customers. So here's the opportunity. The opportunity is, and my corollary is only open if you're ready. You need to meet those guidelines and you need to follow them. But thank goodness they're there for you to follow. But as Anu mentioned earlier, it's very difficult because there's so much information. How do you know where the right information is? And it's open to interpretation. From a safety point of view, you need to ensure proper precautions for your staff and customers. Address the return to work and the day-to-day operations. So as staff are coming back, you need to talk about that, and you need to talk about the day-to-day operations. You need to think about screening, cleaning processes, and you need to be cognizant of making sure staff know to report symptoms and not come to work when they don't need to. From the staff point of view, I recommend that you do have these one-on-one conversations with each individual as you're figuring out when they come back to work, how they'll come back to work. Diane mentioned how they accommodated some people who have health issues or who have families at home with health issues. I'll remind you from a legal perspective, those people who have children or elderly they're caring for, they can tell you that. And if they cannot come to work because of that, in this province of Ontario, they passed a bill that allowed for people to, under the Employment Standards Act, to allow them to keep their jobs, that they could not be terminated as a result of the COVID-19 for staying at home with their families. So you need to be cognizant of that particular legislation piece, so that you're not terminating people because you will be subject to that. That's not something that you can do. So you could be subject to some legal action for that. Use staff for suggestions. I think that's a great idea. I know some companies who actually sit down and say, hey, we need to do this. How will we reopen? And to get the feedback and consensus of people, it makes it easier. When you're a smaller organization, you can have that discussion, and you should, because everybody has ideas that will add to making sure that this is a safe place when you return to your business. Take a proactive approach with staff and make sure that you address and talk to them about their fears and concerns. This is an opportunity to provide safety training, so do make sure it's really, really good and that people really understand what they need to do to keep themselves safe, to keep their families safe, and to keep the business running. When you're assessing supplies, you need to think about making sure you have enough, and to do your stock inventory. What will you supply for your staff, customers, and clients? So think about those things. I walk through with one of my clients. They're only 5 people. They're an accounting firm, and we literally walk through a flow. So just imagine, this is what my staff do from the start of the day to the end of the day. What should we do for that? And then secondly, my clients walking through the door, and then do a process flow and figure out all the points of concern from a safety piece, doing a flow pattern from start of the day to the end of the day, from the start of a customer experience to the end of a customer experience. Reconfigure your space to accommodate social distancing and capacity and staff scheduling. And the 5th point of communication, think of your brand message. Those of you who've heard me over the course of the weeks, I suggest that you understand what is your message to people. The governments of Canada and Ontario have been really good. Their messaging was safety first, family second, and giving you peace of mind by helping you with your finances. And every action that they've done has thought about those. So again, think about your brand message with regards to COVID, and then do the policies, practices, and the communication relevant to your message with regards to COVID-19. And promote what you're doing. Talk to your clients about what you're doing to make it a safer place, and make sure you communicate that effectively. So I want to focus right now on the staff returning to work, and then I'll talk about the physical safety of the workplace. So when a staff member is returning to work, and some people who spoke earlier highlighted on that, some are ready to come back. Some want to stay at home with their families, or if they've got elderly people. And again, I mentioned about the employment standards that says they cannot be terminated as a result of that. Some want to stay on CERB because they don't think it's worth it to return financially. Some people may have people who are working on contract basis that are not employees, or some people may have people that are only working part-time. So you may have a dialogue and decide what you need to do for that. Some will refuse, citing unsafe to work concerns. And I remember an article in the Star a few weeks back when people started coming back, and they had about 243 cases reported of people refusing to come back to work. And when that occurs, as a business owner, you need to work with your safety committee if you have one, or if you're smaller size, your safety representative, but you also must report it to the Minister of Labor. And the Minister of Labor will come and inspect the concern. When they as a result of those 243, what they found was there were no situations, and I repeat, no situations where the Minister of Labor said, this is unsafe, you must close. So people may have concerns, but nobody has had such a concern that it results in closing. What some of those 243 had were opportunities where they were told, oh, you need to maybe provide this, or you need to reconfigure the workspace. So those aren't considered closures, but those are minor suggestions that need to be resolved. Some are very anxious and hesitant to return to work. And I think, remember I said depression will be the #2 leading cause of illness during 2020. So all business owners really need to think about mental health and mental wellness. And I recommend that you think about talking one-on-one. And some may have health issues, as again, somebody pointed out in our pre-open discussion there, that if they do have health issues, and we're talking about, you know, particularly those that affect the lung, whether it's asthma or emphysema, similar type things. So you need to think about that and how you will handle each of these possible responses. Our focus really is on the safety, other safety aspects today, but if you want more details, there are other sessions that I have talked about. In EP3, I talked about effective communications. On EP11 and 12, I talked about how to master difficult conversations at work and doing case studies on that. So those may be pointers for you to help you. And last week, when we talked about, are you ready to reopen your business, we really focused on the staff. So this week, we're really focusing on the PPE side. And you need to think about all of the PPEs that you may need to do. And I put these ones on. I'm not sure if you're in the health industry, so I didn't put gowns on. So that's something, but these are the ones. I found out from my local Chamber of Commerce, they had a guide called the Definitive Guide to Supplies. So this is the link that I've put here, but you may find that there's a local supplier as well. And I noticed that STEM Minds, who is our participants today, actually are listed as one of the companies that are providing some of those supports. So make sure that you have adequate supplies, that you know how to dispose of those supplies, and that you have training for your staff on the use of those supplies. Other things, I talked about process flow, and so to think about the process flow and think it from a safety perspective for your industry. Think of cleanliness, disposal, adequate supplies, education and training, the client customer training, and sometimes it's intuitive training, and so that's why some of these pictures are here. There are a host of posters. If you go into your province and you look for posters for your industry, then you'll say, okay, I'm in the construction industry. They'll have posters for construction industry, for manufacturing industry. Make sure you print these and post them where you need to. They're really, really good. And then markings. I know we've all gone to, maybe not all of us, I've gone to grocery stores because I know some people actually do it online. And there are markings that help you, guide you for how many feet you need to be away. When you're opening, think about what you're going to do. So here's some pictures where every other seat is occupied. It can be occupied and the others aren't. In your lunchroom, you know, make sure you have markings where people should sit. So don't forget your washing, hand washing, and some businesses have decided to do temperature checks for their staff or for the client's customers as they come in. And the thing with that is it's not proven one way or the other, but it's something that you should figure out whether this makes sense for you. People think it gives them peace of mind. And notice the picture with the elevators. I wanted you to do that because they're going to, some organizations saying only 2 to an elevator. This one has quite a few more, but the idea. In Ontario, there's a booklet, and then I put the link here, Post-Pandemic Business Playbook, and it is full of useful information for interpreting and to read and follow through. I've given you some ideas here to think about it. If you have an office, you may think of workstations and then making sure they're staggered and make sure there's lots of disinfectant and sanitizer. One of my clients that I walked through, we talked about at the beginning of the day and at the end of each workday, each person would wipe down their workstation, their computer, their keyboard. They should even wipe down their phones, anything that they think needs to be done. Effectively, how do you communicate with coworkers? You know, keeping that social distancing and using face masks when in close proximity. The government is still encouraging people to work from home remotely. I would suggest that if you have not already done so, you should write policies for that and think about what it's going to be post-COVID as people do that. Some companies are suggesting staggered shifts and staggered lunch breaks. In the kitchen, make sure you have some nice posters to remind people what they should do and shouldn't do, lots of disinfectants. Make sure that you have those adequate supplies. Address what's happening with cleanup. This particular client that I had a small kitchen, only 5 people, so everybody knows where people are more or less, and they've decided only one person is going into the kitchen at a time, and they are to clean up anything that they've touched. I think when you have a larger organization, it'll be a little bit more creative as to what you do. With the bathrooms, again, staggering the bathrooms, making sure people learn good hand washing technique. And that's a 20-second hand wash. And I was not good at 20 seconds, but I'm pretty good now with my 20-second hand wash, particularly when I'm cooking. I can wash them as much as 20 times during the cooking process. Keep social distancing, put posters, and make sure, again, you have adequate. So reopening, will you be ready to reopen safely? And again, you do not have to follow the guidelines on the day to open. Open when you are ready and only if you're ready. So today, in summary, before we open it up to discussion, what we talked about was the risk to your company if you do not open safely. This is a big key thing. You must do it right. There will be major concerns for you with regards to staff, with penalties, and you just want to make sure you do it right. This is the biggest concern. And I spoke earlier that's the essential services that have opened that are really like a Loblaws or a Shoppers. They have a wealth of experience and knowledge. They've got safety experts. They've got HR experts. They've got people that can do all the ordering and source out the ordering as experts. So, but when you're opening and you're a smaller business and there's maybe 10, 20, 50 of you, do you have those supports in place? So make sure you're ready to open. Know your safety guidelines. Look at those workplace safety guidelines. Make sure you have adequate supplies and staffing, that you're communicating effectively, and ensure that safety. So think about those precautions that you need. I've shared with you some tips and strategies. What do you need to do to provide safety for your clients and staff? And I've given some tips, and I've shared with you some of the legal ramifications from an HR perspective. So I want to open it up for questions. And if people want to, share, what are you guys thinking? What kind of questions do you have?
Yeah, we actually have one here from before. So as a manufacturing facility, we have a joint health safety committee. However, none of the worker members are back. What are we required to do at this point?
Okay, just before what is required to do, what was that question?
She was just explaining the situation. So as a manufacturing facility, we have a joint health safety committee. However, none of the worker members are back. What are we required to do at this point?
With regards to the safety committee or with regards to reopening?
Hi, Hilda. It's Casey. That was my question.
Okay. Yes.
So I guess and this came up while you were talking about, reopening and being safe. So the idea that, we have where we're reopening slowly,
Mm-hmm.
we are required to have 4 members on our joint health and safety committee. 2 of them are worker members. None of them are back. So, there are still, I would assume, the once we have reopened, all of the usual safety precautions, in addition to the COVID-19 safety precautions that we are required to do. I mean, they've just been on hold for right now because we have been essentially closed. But as we reopen, my question was just about, okay, well, if we are we now saying that now do we have to elect new members? And then we have the issue now with training, because that means then they're probably not going to be properly trained. I guess I'm just wondering, what are the risks involved, and what what are we required to do once we have now said that we've officially reopened, even though we're not fully open.
Right. And I guess the thing would be, if these people are coming back, they should still be, involved, because just as you said, you don't want to, they're not any people that weren't on the committee would have to get oriented and understand. And so that's the best solution would be to involve those people. If you can get on Zoom chats or phone calls, I think you should elicit their input, even pre-opening, and offer to pay them for this, or however you want to do it. But I really think it's important for your safety committee to see the plan that you have and to support that plan and to offer suggestions. The other thing, as I said, for some companies, they don't have a safety committee. There's no reason why you can't ask a few volunteers to say, we want to get this right. We are opening, and would you be interested in kind of helping us to make sure we're open safely? Because I just think everybody comes from different perspective. In my household, I have a couple of people that are really safety conscious, really safety conscious. So that has upped my game in terms of making sure they feel safe, and things that I didn't think of, they will. So that's why the more input you have at different levels, it's important. So even if it can be as a volunteer or as a paid person, or time back when they come back, I think that's what you need to do.
We had our health and safety meeting while we were in the process of bringing employees back, but because of the timelines, our meeting was due, and we didn't want to miss the timeline. So we had one of our employee reps actually resigned. So we did our meeting through Zoom. Mm-hmm. And we asked another employee who does the same role as the person who left to substitute. And we thought, okay, we'll worry about training and orienting the employee after the fact, because we needed to do this quickly. So that was how we handled the situation.
Yeah. I think creativity and flexibility and adaptability are the rules of today, right? So I think that's a great thing that you did. Yeah.
Okay, thank you, Diane. Thanks, Hilda.
Okay.
Any other thoughts or questions?
I'd like to bring something up if sure. It's all right. Mm-hmm. You've talked a lot about cleanliness and PPE and those sorts of things today. And something that I can suggest to everybody is employees may feel more comfortable, or customers may feel more comfortable if there's a deep cleansing that has been done, and a deep disinfectant of the workplace, of the office, of the store, whatever it is the environment is. If that has been done and communicated to staff and to clients coming in. And if anybody is interested, it is a service that my company provides. I can provide my contact information if anybody is interested in exploring the opportunity or the option for that deep cleansing and disinfecting.
I welcome you to put that in the chat box so people can see the link there for you, Diane. But it's true. I think it's all about communicating to your staff and clients what will give them peace of mind. And I didn't talk about the toilets, but who's cleaning those at the end of the day? And you, depending on your environment, if you're a standalone, you're going to have to be responsible for making sure that cleanliness is done. And the deep clean is an excellent idea. It's peace of mind. And I think, like face masks, some people say that it is beneficial, some people say it's not beneficial, some people say it's only beneficial for you spreading germs. So again, I think you need to think through what you want to do, but there are so many decision points for you, and this is really tough for sure. But I would welcome you putting that in, Diane, because people might say, never thought about that. That's a great idea.
I heard it. Sorry, it's Anu. I just wanted to echo what Diane said. I've actually already, done a contract with a company that will be doing a deep clean disinfection before my staff start working in the premises. And I do totally believe it's the right thing to do. And I totally support Diane's perspective on it. And I think people need to understand that, because a lot of offices have been closed for a little while, even though the infection doesn't sit on the services after 72 hours. If you do that disinfection, you're again reducing one additional risk and starting from a clean slate.
Yeah, I mean, this is all about reducing risk. When you think about your staff walking through the building, your clients and customers walking through the building, just put the safety lens on. Put the safety lens on, and then think about what they're going to want to know, peace of mind. And just saying, we've done a deep cleaning, gives me peace of mind when I go into the grocery stores. So yeah, no, great ideas. Like, other thoughts, because I think this is important, hearing different people's perspectives. I put a list of the webinars on the just so that you're seeing them as we're talking, and we've actually hyperlinked them to each of the YouTubes where we house these seminars so that you can listen to them later. Other comments?
So, Hilda, if I can share some of the few things that we are doing for PPE, because during COVID, we were actually producing PPE for health workers. So we've got ideas and ideas. So
yes.
What we're doing is we've actually bought rolls of APET plastic that we're going to use to build screens for our reception. We're actually building partitions and screens for all our desks as well. So an additional protection, even though kids will be sitting apart, we are still building these transparent shields to provide some form of protection. We're building care kits for our kids who come work with us to give them additional assurances if they need. And our care kit will include like a shield that clips onto baseball hats. So if some kids just need this, especially when they're running around and playing. So we're doing that. We ordered like small hand sanitizer, alcohol-free hand sanitizer, little bottles that we can refill on a regular basis, so kids have them in their knapsack. So we are looking at doing a care package for our students who are our clients in essence. And for all our staff, we have given, we are getting face shields, both reusable fabric masks and 3D printed masks available. So this way it's their choice whether they want to wear it or not, and we are going to do that. We've also had to buy those thermometers and stuff like that that you will have to use as people come in, maintain logs with it, stuff like that. We've also ordered like gloves and stuff like that. So just so we know that the supply is available, because it is very difficult to get. I've been getting some of these supplies since last month because it's hard to get access to it. And what's out there, it is so expensive. Like those reusable masks, like it's almost $40 for 50, and they'll get used up in one day, and that's just not affordable. I'd rather invest in fabric masks if they can be reused. So I actually ended up talking to a seamstress in Toronto who is now building these fabric masks, and again helping a small entrepreneur build her business. But I think these are kind of things we will have to consider, because all of this disposable stuff is very expensive. And screen guards, like the sneeze guards, they start at $250. Like that's just a lot of money to put in. And I was in a call yesterday, and I asked the question, if there are going to be grants given to businesses for COVID readiness. Like it's a lot of funding we don't naturally have in our business, right? So just a few thoughts to consider.
All great advice. Anu is actually the owner of STEM Minds and provides virtual sessions for young people. So you've been keeping parents very happy by offering this. But I think Anu is a person who's been able to shift her business in COVID times on a dime, and very, very recommendable. So thank you for sharing all of your tips and strategies, because I think the more you talk to other people, the more it gets you thinking about what do I need to be COVID ready, and it is expensive. Sarah Llewellyn put here, where can I find supplies? So if you go back to one of my slides, I did, where the PPEs are showing, I did actually share with you where that link is, so I can pop that up right now.
And Hilda, I just shared it in the chat.
Okay, thank you.
Yeah,
You're good.
so then they can also access it through that.
So I think there is so much to think about, so much to be, getting ready, and I know this is a very, very tough time for you guys all to figure it, and the cost is phenomenal. I actually started looking for alcohol because I need to use alcohol in my household. I have only found 6 bottles of alcohol during the probably 12 weeks. I started getting ready 12 weeks beforehand, and it's just not available. I think you can buy it now as if like through the Chamber of Commerce now has all these suppliers, so they're getting it from somewhere. But every time I went to my local grocery store or whatnot, I couldn't find it. I know we're just at 1:45, but I'm certainly happy to take some calls. So let me just finish up a few things for you, and then I will continue to take questions for those who want to stay on. I think you can appreciate now that there's so much that needs to be thought through as you're going through this. And as I said, our company decided that we wanted to help people by giving you information in a timely way that affects your business as a whole or affects human resources. And because my husband and I had our own company, I understand not just from the HR, which is my specialization, but I understand as a business person in all aspects of opening up or managing your business during these times. So what we're offering is an opportunity for you to have a free 30-minute strategy call with me, and we could talk about any aspect with regards to the business or human resources about COVID-19. And I have my calendar link so that you can set that up. So I encourage you to do that. I really care about businesses and I want people to succeed. So do take me up on my offer. Upcoming is episode 17 will focus on mental health and mental wellness, how to reduce risks in the workplace. And my friend Helen Patterson from Life Works Well is an expert in human resources similar to mine, and we both care about people. So we're going to have a dialogue between the two of us about some of the mental health issues, and we'll open it up for discussion as well. We're going to switch to only once a week now, and so the following Wednesday will be episode 18, how to manage performance during COVID-19. People have difficulty with conversations, and that's where my comfort zone is. And so I'm going to dive deep into managing performance, both positive and those of concern. Following that, we're going to talk about building a strong work culture. This is an opportunity for you to build a strong work culture. And I have strategies that will help you. My Connect with RevUp that I founded several years back really can be a recipe for helping you to build strong work cultures. Here are some of the resources. I have put the playbook for that was shown earlier in the slides here, and some of the things that I found helpful. Canadian Federation of Independent Business is a great go-to source. You just click on if you want to know about subsidies, click on that. If you want to know about COVID-19 reopening, click on that. So that's a great source. And then each one of the governments, a few of them are here for your opening. So any other questions, any comments? Because the feedback that you're sharing with others really will help all of you create that COVID-19 reopening plan. It's such a serious thing to get it right. And I'm so glad that so many of you came on and you shared some of your feedback. So open to any last questions and comments from people who really, you know, have done a lot already and want to be able to share that to help the rest of us. So don't forget to unmute yourself if you'd like to talk.
Hilda, I just wanted to thank you for hosting these webinars. I know you've been very active in this journey as well, supporting a lot of people and talking about a lot of topics we in isolation think about. So thank you for, you know, extending your leadership throughout this this period as well. I do appreciate all the updates that I see that come from you. So thank you for that.
Well, thank you. Thank you for that, that comment. I've been doing it because I want to help, and it's just nice when I get some feedback sometimes. I don't need it, but it really is nice because
No,
that's what I want to do.
For me, like just listening to the topics, the discussions, I find that it just, it's, some of them are refreshers, some of them are reminders, but it does create that safe space to say, okay, you know what, I can go to someone and ask for this guidance. So thank you. I do appreciate it.
Okay, thank you. Thank you. Any other?
I like feeling like I'm not alone. Like
Yeah.
this is all new to us as a profession, and I know there's a lot of it. We're winging it. We're trying to accommodate and adjust as things change, and we're just kind of going with the flow. And it's just nice to be able to bounce ideas off other people, and to know that, you know, other people are just kind of guessing at what's the best thing to do as well.
That's so important, I think. And we're HR people, and so imagine what business owners are feeling. And that's why I started this, because I know I have a lot more knowledge to figure out what we should be doing. So my level of comfort is more than others. And I too appreciate, Diane, the fact that we as an HR have a community to support each other. So a lot of the knowledge I get is by keeping connected with my community, with my clients, to understand what's going on so that I can help others. Because the more knowledge we have, the more we can do it, and we can feel more confident with what we're doing. And that's the point of getting this knowledge. And for me, this is the point of doing the webinars, is to share the knowledge that I have, the knowledge that I'm accumulating. Nowhere in the history of my years in business, and so it's 25 plus, have I seen where the knowledge that human resources professionals have has been called to play on so many levels. We do general stuff, you know, the bread and butter 80% of the time. But in the last 3 years, HR professionals have learned to be able to tap into all of the aspects of their knowledge base and all of the skill sets that they are doing. So we're in some ways it's kind of exciting because we're taking advantage of our skills and our knowledge, but in some ways we're learning too. So thank you for that. Other comments?
Well, Sarah shared, thanks Hilda, everyone, challenging times for sure. Great to share experience and ideas and get through this together.
Okay. Well, if there are no other comments, I really thank everybody for taking time from their busy lives and their busy days. We are coming up to the long weekend here in Ontario. I don't know who else celebrates Victoria Day, but we are going to have a long weekend. Do self-care. Do self-care. Our mental health is important, and if our mental health is balanced, then we can focus on what we do. When our stress levels get too high, you can't focus, you can't be productive. So take care of yourself, stay safe, everybody, and thank you very much for joining us. Bye.